Hey, I'm Jack Hartley. I'm the owner of Homestead Senior Care in Valdosta, Thomasville, and Tifton. Today I'd like to talk to you about strokes. There are three main types of strokes that occur that you should know about. One is called an ischemic stroke, and it's the most common. The second one is a hemorrhagic stroke. And then the last one is called a TIA, or Transient Ischemic Attack, or many times people refer to it as a mini stroke. The most common stroke is ischemic, and what happens is the fatty substance that we build up in our arteries, or plaque or whatever, eventually gets to a point where it causes a blockage, and therefore a stroke occurs because of that. There's two types of ischemic strokes. There's one that is known as a thrombotic stroke, and this is caused by a blood clot that forms in an artery that supplies blood to your brain. And then there's one called an embolic stroke. That happens when a clot forms somewhere in your body and it travels through the blood vessels to your brain. It gets stuck there and it stops the flow of blood. The symptoms of an ischemic stroke depend on which parts of your brain is affected. Sudden numbness or weakness in your face, arm, or leg, confusion, problems speaking or understanding others, dizziness, loss of balance or coordination, or trouble walking, vision loss or double vision. You're most likely to have an ischemic stroke if you're over 60, have high blood pressure, heart disease, high cholesterol, or diabetes, you have an irregular heartbeat, or you smoke, or you have a family history of strokes. So those are things you need to think about when considering whether or not you would have a stroke. The other type of a stroke is called a hemorrhagic stroke. And there's two types of those. I'm not going to discuss what they're called, but there are two types of those strokes. So here's what happens as symptoms of a hemorrhagic stroke. Intense headache that people describe as the worst headache I've ever had. Confusion, nausea or throwing up, sensitivity to light, problems with vision, or passing out. My brother-in-law recently passed away for that type of stroke. He complained that night about how bad his head was aching, and sure enough, during the night he had that type of a stroke, and he did pass away. You're most likely to have this type of stroke if you're over age 65, you have high cholesterol, high blood pressure, or diabetes, obese, you've had a stroke in the past, you have a family history of strokes, you smoke, or you eat unhealthily. The last one is called a TIA, or Transient Ischemic Attack. The TIAs are, we call them mini strokes because that's what they are. They may last for a few minutes, or they can last up to 24 hours. And the one thing about the TIA is it will clear up, and you won't have any residual effects from the TIA, but it is basically telling you that you may be having an ischemic stroke soon because you're having these TIAs. Some of the things to look for is a person will just kind of be staring off in space and maybe not be aware of what's going on. They may show confusion, dizziness, loss of balance, trouble walking or understanding, problems with their vision, and severe headache. The rate of chance of getting a TIA depends on your age, again, high blood pressure, high cholesterol, diabetes, and heart disease, obesity, smoking, family history of strokes. And so TIAs are pretty common. As I said, they may last a few minutes, or they may go away in 24 hours. If you want to get more information, one of the sources I use is WebMD. It has a lot of information that you can find out about strokes. And I appreciate you listening, and I hope this has been of some value to you today. Thanks again.